Have you ever climbed into bed after a long, exhausting day, hoping for a peaceful night's sleep, only to find yourself waking up once, twice, or even 5 times just to use the bathroom? At first, you might think it's nothing. Maybe you drank too much water before bed. Maybe it's just part of getting older. But after weeks or months of interrupted sleep, you begin waking up tired instead of refreshed. Your energy starts to dissipate. Your concentration suffers. Your mood changes. Even simple daily tasks begin to feel harder than they should. If this sounds familiar, you're not alone. Millions of people around the world struggle with frequent nighttime urination, a condition doctors call nocturia. While many people assume it's a normal part of aging, the truth is that waking up repeatedly during the night to urinate isn't always something you should ignore. The good news is that, in many cases, healthy lifestyle changes can make a real difference. Small adjustments to your evening routine, eating habits, fluid intake, and sleep environment may help reduce nighttime trips to the bathroom and improve your overall sleep quality. In today's video, we'll explore why frequent nighttime urination happens, what lifestyle habits may help reduce it, and when it's important to speak with a healthcare professional. By the end of this video, you'll have practical, evidence-informed tips you can start using today. So, let's begin. What is nocturia? Nocturia simply means waking from sleep 1 or more times during the night because you need to urinate. Many healthy adults may occasionally wake once, especially after drinking a lot of fluids late in the evening. However, waking up multiple times every night on a regular basis can interfere with healthy sleep and may be linked to an underlying issue. Sleep isn't just about resting. While you sleep, your body repairs tissues, supports your immune system, balances hormones, and helps your brain process memories. Repeated interruptions can leave you feeling exhausted even after spending 8 hours in bed. Why quality sleep matters. Imagine trying to charge your phone, but unplugging it every hour. It would never reach a full charge. Your body works much the same way. Each interruption can reduce the amount of deep sleep and REM sleep you get. Over time, poor sleep may contribute to daytime fatigue, irritability, difficulty concentrating, reduced physical performance, and lower quality of life. That's why reducing unnecessary nighttime bathroom trips can have benefits that extend far beyond better sleep. Common causes of nighttime urination. One of the most common reasons is simply drinking too many fluids during the evening. If you consume large amounts of water, tea, coffee, soft drinks, or juice shortly before bedtime, your bladder may naturally fill during the night. But that's only one possibility. Caffeine is another major factor. Many people enjoy coffee after dinner or a cup of tea while watching television. What they may not realize is that caffeine not only stimulates the brain but can also increase urine production and irritate the bladder in some people. Similarly, alcohol can increase urine production and interfere with normal sleep patterns. While it may make some people feel sleepy initially, it often leads to lighter, more disrupted sleep later in the night. Certain medications can also contribute. For example, diuretics, sometimes called water pills, are designed to help the body eliminate excess fluid. If taken too late in the day, they may increase the need to urinate during the night. Never change the timing of prescribed medication without discussing it with your healthcare provider. Another possibility is an overactive bladder. In this condition, the bladder muscles contract more often than necessary, creating a sudden urge to urinate even when the bladder isn't full. For men, enlargement of the prostate gland becomes more common with age and can make it difficult to empty the bladder completely. This may lead to more frequent trips to the bathroom, especially overnight. Women may experience nighttime urination after pregnancy or menopause due to changes in the pelvic floor muscles and hormone levels. Medical conditions such as diabetes, heart disease, kidney disease, urinary tract infections, or sleep disorders like obstructive sleep apnea may also contribute. Because there are many possible causes, persistent symptoms should always be evaluated by a healthcare professional rather than assumed to be normal. Is aging the only reason? Many people believe that frequent nighttime urination is simply an unavoidable part of growing older. Age can play a role, but it isn't the whole story. As we age, changes in bladder capacity, hormone levels, and sleep patterns can make nocturia more common. However, healthy lifestyle habits and appropriate medical care can often reduce symptoms significantly. That's why it's important not to ignore persistent changes. How interrupted sleep affects daily life. Think about how you feel after one poor night's sleep. Now imagine that happening every night for months. Many people with nocturia describe feeling tired all day. They may struggle to focus at work, feel less patient with family members, or avoid travel because they are worried about restroom access. Older adults may also face a higher risk of falls when walking to the bathroom in the dark. Good nighttime lighting and removing tripping hazards can help reduce this risk. The good news: although nighttime urination can have many causes, healthy habits often make a meaningful difference. Simple changes, such as adjusting when you drink fluids, limiting caffeine and alcohol in the evening, practicing bladder training, strengthening the pelvic floor, maintaining a healthy weight, and improving sleep habits, may help reduce nighttime awakenings for many people. It's important to remember that these lifestyle strategies are not a cure for every medical condition. If your symptoms are caused by an underlying illness, treating that condition is essential. Still, these everyday habits are often a valuable part of improving sleep and supporting overall bladder health. In the next section of this video, we'll look at practical lifestyle changes you can start today, including how to manage evening fluid intake, foods and drinks that may affect your bladder, and simple routines that can help you sleep more comfortably through the night. Natural ways to improve sleep if frequent nighttime urination keeps you awake. Part 2. Healthy habits that may help reduce nighttime urination. Now that we've talked about what nocturia is and some of its common causes, let's focus on something even more important: what you can do about it. The encouraging news is that many people notice improvements by making a few simple changes to their daily routine. These habits don't work overnight for everyone, but with consistency, they may help reduce nighttime bathroom trips and improve your sleep. Let's begin with one of the biggest factors. 1. Pay attention to when you drink fluids. Many people think the solution is to stop drinking water altogether in the evening, but that's not the goal. Your body needs enough water throughout the day to stay healthy. Becoming dehydrated can actually irritate the bladder and make urinary symptoms worse. Instead, focus on timing. Try to drink most of your daily fluids during the morning and afternoon. As bedtime approaches, gradually reduce how much you drink. If your healthcare provider hasn't told you otherwise, many people find it helpful to avoid large amounts of fluids during the last 2 to 3 hours before going to bed. If you're thirsty in the evening, it's perfectly fine to take a few small sips of water. The goal isn't to avoid drinking completely, it's to avoid consuming large volumes right before sleep. 2. Watch out for hidden sources of fluids. Remember that drinks aren't the only source of water. Foods such as watermelon, oranges, grapes, cucumbers, soups, and broths contain a lot of fluid. Eating a large bowl of soup late at night may contribute to a fuller bladder while you're sleeping. If nighttime urination is a regular problem, try having these foods earlier in the day instead of close to bedtime. 3. Reduce caffeine in the evening. Caffeine is one of the most common reasons people wake up to urinate. It's found in coffee, black tea, green tea, many soft drinks, chocolate, and energy drinks. Caffeine can increase urine production and may also irritate the bladder in some individuals. Even if you fall asleep easily after drinking coffee, caffeine may still affect your sleep quality and bladder function. A helpful habit is to avoid caffeinated drinks later in the afternoon and evening. If you enjoy a warm drink before bed, consider switching to a naturally caffeine-free herbal tea, provided it's appropriate for you and doesn't contain ingredients that act as diuretics. 4. Limit alcohol before bed. Some people believe alcohol helps them sleep. While it may make you feel sleepy at first, alcohol often disrupts normal sleep later in the night. It can also increase urine production, making nighttime bathroom trips more likely. If you notice that your symptoms are worse after drinking alcohol in the evening, consider reducing or avoiding it close to bedtime and see if your sleep improves. 5. Empty your bladder before going to sleep. This may sound obvious, but it's a habit many people overlook. Before getting into bed, make one final trip to the bathroom, even if you don't feel a strong urge. Some people also find it helpful to spend an extra few moments relaxing while emptying the bladder rather than rushing. If recommended by a healthcare professional, techniques such as double voiding, waiting a short time and trying to urinate again, may help some individuals empty the bladder more completely. 6. Maintain a healthy body weight. Excess body weight can increase pressure on the bladder and pelvic floor muscles. Over time, This additional pressure may contribute to urinary symptoms. If you're overweight, gradual weight loss through healthy eating and regular physical activity may help improve bladder function while also supporting heart health, blood pressure, and blood sugar control. There's no need for extreme diets. Small, sustainable lifestyle changes often produce the best long-term results. 7. Stay active during the day. Regular physical activity offers many benefits beyond fitness. Exercise supports healthy circulation, helps manage stress, improves sleep quality, and can contribute to maintaining a healthy weight. Aim for activities you enjoy, such as walking, cycling, swimming, or gentle stretching. Even 20 to 30 minutes of movement on most days can make a positive difference. However, try to avoid very intense exercise immediately before bedtime, as it may make it harder for some people to fall asleep. 8. Reduce swelling in the legs. For some individuals, especially older adults, fluid collects in the legs during the day. When they lie down at night, that fluid returns to the bloodstream, and the kidneys filter it into urine. If your healthcare provider says it's appropriate, elevating your legs for a short period in the evening or wearing prescribed compression stockings during the day may help reduce this nighttime fluid shift. Never begin compression therapy without medical advice, especially if you have circulation or heart problems. 9. Create a relaxing bedtime routine. Stress doesn't directly cause nocturia, but it can make sleep lighter and increase awareness of bladder sensations. Developing a calming bedtime routine may help you fall asleep more easily and return to sleep more quickly if you do wake up. Consider reading a book, practicing deep breathing, listening to calming music, or doing gentle stretching before bed. Try to avoid scrolling on your phone or watching stimulating content right before sleep, as bright screens can interfere with your body's natural sleep cycle. 10. Improve your sleep environment. Sometimes it's not only the bladder waking you up. A room that's too bright, too noisy, or too warm can interrupt sleep, making you more aware of the urge to urinate. Simple improvements include: keep your bedroom cool and comfortable. Use blackout curtains if outside light is a problem. Reduce unnecessary noise with a fan or white noise machine if needed. Choose a supportive mattress and pillow. Better sleep may reduce awakenings that lead you to notice your bladder. 11. Don't ignore constipation. Many people don't realize that constipation can put pressure on the bladder.